Hey everyone, and welcome back to the channel. Today we're diving into a topic that's super common in medicine but often misunderstood by the public: off-label prescribing, specifically when it comes to psychiatric medications. You might be surprised to learn that a medication prescribed for one condition is frequently used to treat something entirely different. So, what exactly does off-label mean, and why do doctors do it? Let's get into it. First, let's break down the terminology. When a pharmaceutical company develops a new drug, they have to go through a long and expensive process to get it approved by regulatory bodies like the FDA in the United States. They conduct clinical trials to prove the drug is safe and effective for a specific condition. Once approved, that condition is what's listed on the drug's official label. Off-label prescribing is when a doctor prescribes that same drug for a condition that isn't on the official label. Now, you might be thinking, is that even legal? The answer is yes. It's perfectly legal and incredibly common across all fields of medicine, not just psychiatry. Once a drug is approved for the market, doctors can use their professional judgment to prescribe it for other purposes if they believe it will benefit their patient, based on scientific evidence and clinical experience. So why does this happen so often in psychiatry? Well, our brains are incredibly complex. Many mental health conditions share overlapping symptoms and involve similar brain chemicals, or neurotransmitters, like serotonin, dopamine, and norepinephrine. A drug developed to treat depression by targeting serotonin might also be effective for an anxiety disorder that involves the same neurotransmitter system. Running massive, multi-million-dollar clinical trials for every single potential use of a drug just isn't feasible for drug companies. So, the medical community often relies on smaller studies, clinical experience, and emerging research to guide off-label use. Let's look at one of the biggest categories where this happens: antidepressants. These are, of course, officially approved to treat major depressive disorder, but they are some of the most versatile drugs in psychiatry. SSRIs, or selective serotonin reuptake inhibitors, like Fluoxetine, known as Prozac or Sertraline or Zoloft, are very commonly prescribed off-label for a wide range of anxiety disorders. This includes generalized anxiety disorder, panic disorder, social anxiety, and obsessive-compulsive disorder, or OCD. In fact, for many of these conditions, antidepressants are now considered a first-line treatment, even though it started as an off-label use. They are also used for post-traumatic stress disorder, PTSD, and even premenstrual dysphoric disorder, or PMDD. Another class, the tricyclic antidepressants, like Amitriptyline, also known as Ilevel, are often used in low doses to treat chronic pain, migraines, and insomnia, which is far from their original purpose. Now let's talk about a specific medication. Many of you may have heard of Seroquel, which is the brand name for Quetiapine. Seroquel is officially classified as an atypical antipsychotic. Its on-label uses are for treating schizophrenia, bipolar disorder, and as an add-on treatment for major depressive disorder. However, its off-label use is massive, particularly for insomnia and anxiety. Why? Because one of its side effects, especially at lower doses, is significant sedation. It makes people drowsy. Many doctors prescribe low-dose Seroquel for individuals with severe treatment-resistant insomnia, especially if they also have a mood disorder. While it can be effective for sleep, this use is controversial. Seroquel is a powerful medication with a significant side effect profile, including the risk of weight gain, metabolic changes like high blood sugar and cholesterol, and long-term risks like tardive dyskinesia, which involves involuntary muscle movements. Many experts argue that the risks often outweigh the benefits when it's used solely for sleep, especially when safer alternatives exist. It's a classic example of the complex risk-benefit calculation a doctor and patient must make together. This brings us to the broader category of antipsychotics. They Seroquel, other atypical antipsychotics like olanzapine, brand name Zyprexa or Risperidone, sold under the brand name Risperidone, are also used off-label. They might be used in low doses to augment antidepressants for treatment-resistant depression, or to help manage severe anxiety or agitation. In some cases, they're used for behavioral issues and dementia, although this is also highly controversial due to the increased risks for elderly patients. The guiding principle is usually to use the lowest effective dose for the shortest possible time. Antipsychotics work primarily by blocking dopamine receptors, but they affect other neurotransmitters too, which gives them a broad range of effects, and thus, a broad range of potential off-label uses. Another classic example is a medication called Chlorpromazine, which you might know by its brand name Thorazine. This was one of the very first antipsychotic drugs developed back in the 1950s, a real game-changer for treating conditions like schizophrenia. But over the years, doctors discovered it could be helpful for other things too. For instance, it's sometimes used in very low doses to help with severe, persistent hiccups that don't respond to other treatments. Can you believe that? It's also been used to manage severe nausea and vomiting. Finally, let's touch on mood stabilizers. The classic mood stabilizer is lithium, which is the gold standard for treating bipolar disorder. Other drugs in this class, often borrowed from the world of epilepsy, include valproic acid or Lamotrigine and Carbamazepine, also known as Tegretol. These are called anticonvulsants. While their primary on-label use is for bipolar disorder to prevent manic and depressive episodes, they have found other roles. For example, Lamotrigine is sometimes used off-label as an aid-on treatment for depression. Some mood stabilizers, like Topiramate brand name Topiramate, are used off-label for impulse control issues, anger management, and even to help with alcohol dependence. Again, this is because the brain pathways that control mood, seizures, and impulses can overlap. By stabilizing electrical activity in the brain for seizures, these drugs can sometimes also help stabilize mood and behavior. So, what's the big takeaway here? Off-label prescribing is a vital tool in a doctor's toolbox, allowing for personalized and flexible treatment. It allows doctors to adapt to new research faster than the official approval process can. However, it's not without its risks. When a drug is used off-label, it means it hasn't gone through the same rigorous large-scale testing for that specific condition. The evidence for its use might be less robust, and the potential for unexpected side effects might be higher. This is why communication with your doctor is absolutely critical. If you're prescribed a medication, it's always a good idea to ask what it's for and whether it's being used on-label or off-label. A good doctor will be happy to explain their reasoning, the evidence they're basing their decision on, and the potential risks and benefits. It allows you to be an active, informed participant in your own treatment plan. Remember, the goal is always to find the safest, most effective treatment for you as an individual. It's also important to remember that finding the right medication and dosage can be a journey of trial and error. If you're struggling with your mental health, please reach out and talk to a healthcare professional. There are so many treatment options available, and they can help guide you to the one that's right for you. If you ever feel like you're in a crisis, please contact a crisis hotline or emergency services immediately. Your well-being is the top priority. Thanks so much for watching today. I hope this cleared up some of the confusion around off-label prescribing in psychiatry. If you find this video helpful, please give it a thumbs up and consider subscribing for more content just like this. And as always, leave your questions and comments down below. I love hearing from you. Stay safe, stay informed, and I'll see you in the next video.